Hometown Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
Hi again, everyone. Welcome to our community service program. Today, Muenster Memorial Hospital Day, and we're going to talk a little bit about hand therapy. Now, there's all different kinds of therapy around, but hand therapy is one that, unless you've had a problem with your hands, you probably haven't heard of. And Leslie Schilling is a hand therapist at Muenster Memorial Hospital. Welcome to the show.
Thank you for having me.
It's great to have you here. First of all, tell us a little bit about yourself. You're a Muenster girl, aren't you?
Well, I didn't grow up in Muenster. Both of my parents are from Muenster and Lindsay. But when I was a young child, we moved away, and then I married a Muenster guy, and so we moved to Muenster. So anyway, so it all came back around then.
Yeah. Full circle, it sounds like. How did you get into to being in the therapy business?
Well, when I got out of high school, I was kind of searching for something in science, and my mom was a chemo nurse for an occupational therapist, and so I kind of started shadowing her, and I went to work with her a little bit, and I decided it was, seemed very fun and interesting, and so I applied to school, and I got in right away. And
I guess when I think of hand therapy, I think you're just working with the hand, but in reality, in training, and I guess in getting degree and certified, you really are certified in occupational therapy with a specialty in hands, right?
Correct. Yes, this is correct. They have actually changed the certification requirements to make them a little bit easier than what they used to be. But you do have to have, before you can even apply to get certified in hands, you have to be an occupational therapist or a physical therapist for it's 3 years now. It used to be 5 years. When I actually certified, it was 5 years. Then you have to have 4,000 hours in the upper quarter, which includes shoulder, elbow, wrist, and hand therapy only. You have to have all that documented, and then you can apply to take an exam. And the exam, now I haven't checked the figures on this. They used to like to run about a 50 to 60% pass rate. So they made it very difficult. But
well, and it should be difficult. You should know your stuff. And there aren't just a whole lot of certified hand therapists out there, are there?
No. The majority of them are actually here in the United States. But no, they are kind of few and far between. We have about, I looked at the stats on this. We have 6,044 right now in the United States.
Wow. And so, I mean, that's phenomenal. There aren't any more than that. But you being a little speck on the big map that doesn't have a lot of specks on it, but when you narrow it down, I guess when you're talking, our area, Cooke, Montague, Grayson, you really are kind of out on an island there, aren't you?
Yes. Yeah, it is we're kind of few and far between, but, and it is kind of a small therapy world too, because most hand surgeons have a hand therapist. So having worked across the Metroplex before I did come back to Muenster, it's kind of funny how many of the hand therapists and if you don't know that one, you know somebody who does know them. So we're kind of a small world there too.
Get specific about what sparked your interest in this particular area of therapy.
Well, when I was in school, if you would have asked me if I wanted to go into hand therapy, I would have said absolutely not, because it's so intricate and so complicated. But when you are in occupational therapy school, you have field works before they'll license you to work. And so my first one was actually a surprise in hand therapy. And so I was just kind of thrown into it. And then my very first job, they needed a hand therapist, and I just happened to have a connection. And so I got into it that way. It wasn't because I said, oh, I want to be a hand therapist. I was just kind of thrown into it. And then it definitely went, it was good. It went from there. I mean, then I went to work for a a hand surgeon, and he really pushed for me to join the American Society of Hand Therapists and really, continue and try to get certified. And so it all worked out.
What type of patients do you see? Give us an idea of I guess it's probably maybe more than just hands. It
is more than hands. I do see some shoulders. I really, it was rare that I saw a shoulder when I worked in Denton because we were so busy with elbow, wrist, and finger injuries. But now I definitely, and I have in the past, seen some shoulders, elbow injuries, wrist and finger injuries, of course, but mostly of usually fractures is probably my main, or breaking the bone is the main reason I see people, because usually they've lost motion of whatever joint that they have fractured. And then I see ligament, tendon injuries, nerve injuries, arthritis, people that have lost motion with arthritis. Definitely have my, sports injuries, lots of crush injuries in this area. Yes, just from, I guess, because of all the heavy farm equipment. But definitely the majority are fractures. People falling. Definitely people falling.
Yeah. And talk a little bit about what is involved in therapy. You can't go over all of it, but if I came in to you and I'm recovering from a broken hand, what can I expect in therapy?
Usually I will heat you up a little bit to get all those soft tissues nice and warm and ready to move, and your blood flowing really well. And then I'll try to move it a little bit, and I'll stretch you a little bit, and then I have what lots of my patients call toys, and they make you move your wrist or your fingers or elbow or whatever we're working on, and then that's usually it. I have to have a little bit of feel good in there, so we do a little bit of massage, so just so you'll continue with your therapy. But and some people require different modalities. Every once in a while, I'll have somebody that needs some electrical stimulation, either for pain or to try to gain motion, or ultrasound, and that does the same. It's more of a not a heating element, but it moves the tissues and gets it can help with scars and pain as well.
And what about success stories? I know nobody likes to brag on themselves, but talk about a success story or two that you're proud of.
Well, I've had some really bad motorcycle injury patients. They came to me just crushed. Those are the best ones, because they really got good function back. So, and I'm speaking of someone in particular, but he would know who it is.
Yeah, and sometimes I would imagine also it can be difficult because you probably know a lot of these patients, or at least familiar with them, because hey, Muenster's a pretty small community. Cooke County's a pretty small community.
It is. It's kind of funny. The majority of the patients I see are not from Muenster.
Really?
Quite a few of them come from Gainesville, Era. I have a lot from St. Joe, or, even just the Montague County area. I've had Era, all the surrounding areas, but I do get my patients from Muenster too. So it all works. And, I was kind of worried about when I first came to Muenster about really having a hand program, would there really be enough patients? But I definitely have stayed busy. So it's been really, really nice.
Yeah. And folks, I just want to tell you, I can attest, I was in therapy for a quad tendon repair. And, I saw Leslie over there working with quite a few people on my visits over there. And it seems like you've got every aspect covered. And I don't know all the aspects, of course, but it just seems like your patients are happy. That it seems like they make progress pretty quickly, and it seems like you're happy with that progress.
I am. I'm very happy. It's been really a good program at Muenster.
Yeah, and I guess so. You are kind of surprised how well it's worked out in a small hospital setting.
I really am. I was very nervous because with my certification, I have to keep a certain amount of hand patients. And if you don't, you have to keep this documented and ongoing. And if you don't, you could lose your certification. So really, for the first 5 years I was there, I really kept track of the amount of time I was spending with hand therapy patients, and just to make sure that I had enough. And it was well over. So I was happy with that.
Yeah, that's great. Well, keep up the good work, and thanks for taking time out to come see us today.
And thank you very much for having me.
Appreciate it, Leslie. Leslie Schilling, hand therapist at Muenster Memorial Hospital. And that's going to wrap it up for our community service program today here on Hometown Radio 1580 KGAF.